Somebody dies every 30 seconds in the world. The death certificate clearly states the illness that led to the death, but seldom the cause of that illness. Each year we have more medicines, more prescription drugs, and more surgical techniques, yet as a whole, our health is declining. In the US alone, 25 million pills are taken per hour every single day. And yet the US is ranked 37th among the top 39 industrial countries of the world. Even people who thought they would never get sick have fallen victim to illness or injury. Despite the current healthcare confusion and uncertainty, you can do something to significantly increase your level of health and peak performance. This video presentation was made exclusively for your chiropractor, who's dedicated to pursuing the most advanced results possible for you. Hello, I'm Dr. CJ Mertz, President of the International Chiropractors Association. In just a few minutes, your chiropractor will show you the findings of your recent examination. The tests performed in that examination are among the most valuable and informative known today. The examination is highly specialized, and so are the findings. It would be a costly mistake to misunderstand, misinterpret, or underestimate the consequences of these findings. The next few minutes of this presentation will help you understand your chiropractor's report of findings more clearly and illustrate the importance of your chiropractor's recommendation for specific chiropractic care. Be sure to listen very carefully. This information may be the answer to reaching your health goals as well as those of your family. Scientific research has shown that nearly every illness and disease can be traced back to a breakdown somewhere in the body's nervous system. There are nearly 75 trillion cells in your body under the direct influence of your brain. If something interrupts the message going from your brain to any part of your body, those cells can weaken and function poorly. The result is a lowered state of health. Now, in 1895, a man named D.D. Palmer made one of the greatest scientific breakthroughs in history. He realized that conventional healthcare treated diseases by prescribing drugs or using over-the-counter medication. And this method just wasn't working. It was a matter of trial and error, which often led to poor results. After years of exhaustive study and research, Dr. Palmer discovered that stress or trauma can cause the bones in your spinal column to become misaligned. When this happens, it puts squeezing pressure on the nerves and blocks the brain messages to one or more parts of your body. The chiropractic term for misalignment of spinal column is vertebral subluxation. Even before your body exhibits symptoms, vertebral subluxation has diminished the nerve flow and cells have started functioning improperly. Now, medication only masks those symptoms without really doing anything about the real cause of the problem, which is almost always an interruption to the nervous system. Vertebral subluxation can affect every man, woman, and child, which is why the chiropractic profession in the US, Canada, Europe, Australia, New Zealand, and Asia is working vigorously to educate every family about vertebral subluxation within the next 10 years. To remove damaging stress to the nervous system, subluxations have got to be located and corrected. When the spinal bones return to their proper position through a series of specific chiropractic adjustments, optimal nerve flow is once again achieved. Optimal health is now possible through the cells and organs of your body with proper wellness care. Optimal health is measured by how well your nervous system carries messages from your brain to each part of your body, not just by how you're feeling. So why is it that your chiropractor wouldn't evaluate your health simply by how you're feeling? Because almost 40% of the people who suffer a heart attack die without feeling any prior signs or symptoms. There are 6 factors which determine the seriousness of your case, the length of your healing time, and the amount of chiropractic corrective care needed before wellness care can begin. First, the presence of vertebral subluxation. If your chiropractor accurately confirms the presence of vertebral subluxation, you are eligible for corrective care. Second, the number and degree of subluxations found in your spine determine the seriousness of your care. Third, the number of years subluxations have existed in your spinal column. Fourth, your age and your level of health upon first visiting your chiropractor's office. Fifth, the amount of tissue damage present, and the percentage of your body affected because of nerve interference. And sixth, the number of traumas that you've had in your life. Certainly, the greater number of traumas you've experienced and your age can significantly alter the body's ability to return to proper functioning. Each chiropractic exam is designed to locate subluxations and relate them to the conditions and illnesses that you're now experiencing. The most important tests are a specific chiropractic postural exam, a bilateral weight scale distribution exam, a spinal palpation exam, and specific chiropractic x-rays. The x-rays can clearly show where the subluxations are and how long they've been there. The longer you suffer from subluxation, the more wear and tear it can cause. Eventually, it can cause the spinal bones to decay. Here's an example of a normal neck as seen from the side. Now here are 3 distinct phases of degeneration caused by subluxation. Each phase puts more pressure on delicate nerve tissues, wears out disc pads between spinal bones, and may cause spinal bones to become arthritic and brittle. The more progressive the phase of decay, the longer it can take to heal and restore optimal health. Corrective subluxation care can range anywhere from 6 months to 5 years, depending on how severe your vertebral subluxations are. The goal is to return 100% of communication of your brain's messages to all parts of your body by removing the pressure on nerves caused by vertebral subluxation. In just a few minutes, your chiropractor will go over your x-rays and examination results with you. When you look at your x-rays, match them with one of the phases of degeneration. Your chiropractor will certainly confirm these findings with you. Vertebral subluxation can be the result of daily stress or even specific traumas that you've experienced throughout your life. Many people have suffered vertebral subluxation since childhood and didn't even know it. Using specific chiropractic adjustments to correct subluxations and restore proper nerve flow and optimal health is the first goal of your chiropractor. The second goal is to maintain proper nerve flow throughout your entire body with routine checkups to prevent the damaging effects of vertebral subluxation in the future. Chiropractic care can provide tremendous health benefits for you and your family. For more information, your chiropractor will be informing you of a family workshop available. The best way to improve the quality of your life is to improve the quality of your health. You can do this by letting your body express 100% of your brain's messages 100% of the time. Not just tomorrow or next month or even next year, but for an entire lifetime. Your chiropractor will recommend ways that you and your family can control vertebral subluxation and improve your lifestyle. Please consider these recommendations and follow through. Millions of people around the world are currently seeing a chiropractor. They enjoy optimal health now with chiropractic care, and so can you, no matter how critical your situation might be. If your chiropractor does confirm the presence of vertebral subluxation in your case, then you've made the right decision to get checked in this office. Listen carefully to your doctor's recommendation for care, because your chiropractor is the only health professional who specializes in vertebral subluxation. Let the chiropractic assistant know that you've completed this presentation. Your chiropractor will be with you shortly. I'm Dr. C.J. Mertz. I wish you all the best in life and in health.